somehow few managements of pickup and dehydration is all in here. The common prescriptions in diarrhea, okay? So, where's the scratch paper? For based on the CPG guideline or clinical practice guideline for diarrhea in Philippines. So, check the clinical practice guideline in your country. But it's almost all the same. It's based on Nelson also. Okay? We have no signs, mild, moderate, severe. Sometimes we have no signs, some signs, severe signs of dehydration. Okay? So, you should know how to identify no sign, mild to moderate signs, or some signs to severe dehydration, okay? Very sunken eyeball, super dry lips, dry skin, no tears already, no urine output for more than 6 hours already, yan, decreased activity for the patient, the perfusion of the patient, check it for signs of dehydration. Always, educate also the parents what to watch out for. If you see patients with no signs of dehydration, educate them before you send them home. Always tell them to watch out for these signs. If there are any noticeable signs of dehydration, immediately go to the emergency room. Okay? So, in the CPG guidelines of the Philippines, if there is no signs of dehydration, what are you gonna do? So, the primary management is to hydrate the patient. Okay? If the patient can tolerate oral rehydrating solution, so if it's less than 2-year-old, what will you give? Give what? 50 to 100 ml of ORS per bouts of loose stool or vomiting. Okay, LBM or vomiting. Okay? Meaning, if the patient poop already, ask them to give 50 to 100. If the patient poop again, give 50 to 100. If the patient vomit, let the patient rest. Do not give any oral fluid or food for 30 minutes. Because if you give, they might continue to vomit again. So, let the bowelers for at least 30 minutes. If there's no vomiting, give again 50 to 100. So, you can replace what is being lost in the body. For 2 to 10-year-old, so you will give 100 to 200 ml per bouts of LBM and vomiting. If it's 10 years old above, so as much as the child wants. So, if the amount is 1 cup, based on your HPI, 1 cup of vomiting, or approximately 1 cup of LBM, you should give again 1 cup of ORS, or more than that, so that the patient can be hydrated. But if there's mild to moderate signs of dehydration, mild to moderate, or some signs of dehydration, okay? You will give, this is the formula, weight times 75 cc per kilogram. Meaning, in every kilogram, you will give 75 cc in 4 hours. That's for the ORS, ha? Okay? So, example, plus this one. Okay? Example, if a patient is 10 kilograms with dry lips, sunken eyeball, okay, you will give 10 times 75 is 750 cc in 4 hours. But what if the patient had LBM pa for 3 times already? So, from 750, and if the patient is, example, 2-year-old. So, aside from 750 within 4 hours, you will give 50 to 100 per bouts of loose stool.
Oh,
okay.
Okay?
So, plus add 50 to 100 ml per bouts of loose stool. Meaning, 750 divided by 4, how much is that? Divided by 4, it's 187 or 188 cc per hour. Cc per hour plus 50 to 100 ml. Okay? If the patient can tolerate ORS, despite LVM and vomiting, then you can send home the patient. That's why I'm asking before we let go of the patient with diarrhea or LVM, if they can drink ORS. Because if you, example, you hydrate the patient here, then you resolve the dehydration. But there's vomiting and LVM at home pa rin, and they cannot drink ORS. You send home without knowing if they can tolerate ORS or not, the dehydration will happen again. But if it's mild to moderate or no signs of dehydration, able to tolerate ORS, and you send home, you are comfortable that the patient can recover. Okay? So, what if in the ER, you try to give ORS and the patient vomit again, cannot tolerate, cannot drink ORS, you proceed to, in guidelines, it's, the ideal is NGT, but you cannot insert NGT left and right to the patient. They will just pull it out. So what we do here in ER, IV. So the computation is still the same. Weight, weight times 75. That's again example. Plain NSS. You will give plain NSS if you're not sure if the patient has urine output or not. Because if the patient has no urine output for at least 4 hours to 6 hours already, and you give plain LR, plain LR has potassium. If you give potassium, you can induce acute kidney injury to the patient. So better, safest is to give plain NSS. It's only sodium and chloride. Example, plain NSS, you write 188 cc per hour for 4 hours. That's the rate. Then reevaluate every hour. Then, while having the IV fluid, make sure the patient can drink ORS while observing. If not, admit the patient. Okay? Or observe for a while in ER if really cannot tolerate. Then admit. Okay?
Yes, please.
That's the flow. So, plus ORS again. The ORS you advise. And then, for severe signs of dehydration, we have the 30-70 rule. So, let's make a table like this. So, the 30-70 rule. So, we have less than 1 year old and more than 1 year old. For less than 1 year old, if severe signs of dehydration, the first hydration is 30 cc per kilogram. The second hydration is 70 cc per kilogram. So, the rate, if it's younger than 1 year old, the rate will be, this will be given for 1 hour, and the second one will be given for 5 hours. For larger patient, you can give it faster. You just have the duration. This one for 30 minutes, and this one is for 2.5 hours. But make sure reassess the patient from time to time. So if it's 1 hour, reassess the patient before you go to 70 cc. For the 70 cc, you're hydrating for 5 hours. Reevaluate from time to time if you're overhydrating or underhydrating the patient. So example, if severe signs of dehydration, a less than 1 year old patient with 10 kilograms weight again. So for the first hydration, 30 times 10 is 300 cc over 1 hour. The next hydration will be 70 times 10, that's 700 cc divided by 5 because it's per hour. So 700 divided by 5, the rate will be 140 cc per hour for 5 hours. Okay? But reassess. If there's still signs of dehydration, if when you finish this, you can repeat again. Okay?
Doc, you repeat from 30 again or you
Yes, repeat again from 30. Okay?
So, what if at that point you realize you are overhydrating? Do you stop?
Yeah, you reassess the patient because the guideline is just a guide.
Okay.
Because you cannot tailor your management. This patient has LVM. All of your management will be like this. You should reassess the patient. That's your purpose as a doctor. It's just a guide, but you can deviate from the guideline, but not too much. Okay? You should know your clinical eye. Okay? So, it's a matter of reassessment of the patient. Okay? Because you're the one who's gonna see the patient. And then, if the patient is well already, you can compute also the holiday CIGAR. For those patients who are just well with no signs of dehydration, no LVM, no fever, you can compute holiday CIGAR technique. What's the holiday CIGAR? The common method for computing the maintenance fluid. Maintenance fluid is the one, if you're well, just like you, if I hydrate, I'll just give you maintenance. Okay? For the first 10 kilograms, multiply it by 100. For the second 10 kilogram, multiply it by 50. For the third succeeding kilogram will be multiplied by 20. So example, 25 kilogram patient. If you compute the maintenance, 10 times 100 is 1,000 cc. Tapos 10 times 50 is 500 cc. And for the 10, it's 20 already. You will have remaining 5, right? So 5 times 20 is 100 cc. A total of 16. So the total requirement of fluid for a well patient is 1,600 ml in 24 hours. So divide it by 24, you will have the rate for the whole day. 67 cc per hour. Okay? Example, the patient has fever. Di ba we have the insensible loss of 10 to 20%. You can add 10% from the maintenance. Example, the requirement is 1.6. You will add 10%. This is the 100%, di ba? So we'll just multiply 1.6 times 1.1. You will get the
Insensible loss.
1,000.
times 1.1 o 1,760. Just divide it by 24. The rate will be 73 to 74 cc per hour. It's just the same as 1.6 times 0.1. That 10%, then you add 1.6. It's just the same.
Yes.
Okay?
Yes po.
So, you will add depending on the percentage. There's another way, the Luden's technique, this one. You can also try this one. I try either of the two techniques. This one. Ayan. For Ludens, yan, in hydration, they have mild, moderate, severe. Example, less than 10 kilograms, then less than 2 patients with mild signs of dehydration. So, example, 10 kilograms, mild signs. So, 10 times 50, 500. You will give it into 6 to 8 hours. So, if you choose 6 hours, divided by 6. If you choose 8 hours, divided by 8, you will get the rate. For moderate, example, 10 times 100.
1,000.
So, 1,000. The 1/4 is 250. You will give the 250 for the first hour. Then the 750, you will divide it to 5 or 7 hours, depending on the patient. For severe, this one, example, 150 cc times 10, again, 10 kilograms, 1.5. So, the 1/3, you will divide 1.5 by 3, so 500 for the first hour. Then, the 1,000 in 5 to 7 hours. Okay, so you can try different technique as long as you keep on evaluating the patient. This is what I'm talking about. It's the simple method.